One misstep can mean life or death when working in the hospital. So, while working in an operating room, preoperative procedures are extremely important in correlation to the success of the surgery. For my internship, I was able to intern with Dr. William Davis, and he goes by Bill. He is a general and trauma surgeon that has been in practice for over 25 years. He works at many different places throughout the day, some of them being Western Medical, which is a hospital located in Santa Ana. He also works at La Vida Surgical Center. This is a surgical center that is owned by surgeons, so only the best of the best can work there, as well as the nurses and the surgeons who are there, as well as La Vida. He also owns his own office. This is called William Davis, MD. It is also in Santa Ana. So all the three places that he works in are in very close range of each other, so he can easily commute throughout the day to all three of these places. As you can see on my slide, this is a picture of Dr. Davis at La Vida Surgical Center right before we were going to go into surgery, and that is him scrubbing up. So, like I said, a day in the life for Dr. Davis is going to 3 different facilities throughout the day. His advisor usually tries to schedule his surgeries so he can do all surgeries at one hospital back to back and then move on to the other places. He usually starts his day at La Vida and has 1 or 2 general surgeries there, as well as checking up on patients that he has worked on. Then he will move on to West Med. He will usually only make rounds there, or for when I was with him, he only made rounds there because West Med is where all his trauma patients are. So he gets all the people from the ER room and operates on them. And then when I was with him, we were able to make rounds there and see some of the trauma cases he had. And he usually ends his day at his office. There he does, again, like general surgeries as well as checkups with his trauma patients as well as patients from La Vida Surgical Center. All these places are only around 5 to 10 minutes away from each other, so he can easily commute from place to place and be on time. So typically, like I said, while at La Vida, Dr. Davis does general surgery. So this usually entails hernia repairs as well as gallbladder removal, which are usually standard and only take an hour to an hour and a half. A lot of his surgeries he does are laparoscopic, which just means you use a tool to go inside of the body instead of actually opening up the whole chest cavity or stomach of a patient. And it's a lot faster and more efficient and leaves a smaller scar. While at West Med, he makes rounds. This just entails going from patient to patient, asking them questions, seeing how they're doing, possibly prescribing medication if needed. This is really important for trauma patients because they do need a lot of care, so it's good for the doctor to check up on them. And then while his own office, most of the stuff there is checkups, seeing how the patient's doing and when they need to come back for follow-up. It's pretty easy at his office. So some of the skills I learned while interning with Dr. Davis were how to run basic preoperative procedures, how to talk to patients before the surgery to try to get them ready for what's about to happen to them. I learned how to scrub up for surgery. As you can see in this photo, me and Dr. Davis are scrubbed and ready. This was actually for a laparoscopic hernia repair that I was able to watch, and we are in the operating room at La Vida Surgical Center. While watching surgery, I was able to thoroughly see how to surgically prep skin, which I will go into a lot more detail later, and I learned how to make rounds and just how to fill out the forms that you do while making rounds. So here are two of the procedures I was able to watch. Sorry about the pictures, they're a little blurry because we could not get the patient in the photos due to confidentiality reasons. So if you are looking on the left-hand side, this was the laparoscopic hernia I was able to watch. It was super interesting, and Dr. Davis kind of talked to me a little bit about the steps that go into it. And here, this is actually the hernia they're repairing. You can see it on the screen. And the one to the right was a gallbladder removal that I was able to watch. That was super interesting, and surgery was an amazing experience. I never thought I'd be able to do something like that. I don't have a picture, but I was actually able to watch two hernia repairs. Both of them were extremely interesting to me. So, preoperative procedures. These are so important to the success of the surgery. It could really make or break how the surgery goes, even if you're not doing the life-threatening things. They lead up to the actual surgery and how well the patient's body will react to what you're doing to it. So running tests is so important. Days before, sometimes even weeks before the actual surgery, patients need to make appointments to run tests for their body to be prepared for what's going to happen and to see if they're stable enough for this actually to occur. So before, on the day of the surgery, the surgeon and nurse will actually visit the patient. While they're in the patient's room with the family, they will try to walk through what's going to happen to them in the procedure in non-stress provoking ways to try to calm the patient's nerves. They will, while after talking to the patients, they will start prepping the operating room. As you can see in this photo, this is a picture of a prepped operating room. This is a sterile table with all the sterile tools that will be used during surgery. And if you look very far to the right, you can kind of see the patient's feet covered by drapes on the table. So after the operating room is prepared, the patient will be brought in, and then they will cover him with drapes. The anesthesia will be applied, so the patients will be out cold and ready for surgery. After the patient is brought in, the nurse, sometimes the surgeon does it, but usually it's a nurse, will examine the skin based on the type of surgery. They'll figure out where the skin prep will be and what type of solution they'll need to be used and such, and then they will actually start the surgical skin preparation. So, for the surgical skin prep, the first step is to determine where the surgical type is. So, depending on the surgery, this will tell you exactly where the skin will need to be prepped will be. Usually you'll use an alcohol-based solution, but if it is in a sensitive area, like the eyes, the ears, around the mouth, an alcohol-based solution cannot be used because it is too toxic for it. So any non-sensitive areas or where the skin is not in contact, an alcohol-based solution will be used because it has the least amount of chance of causing infection. The next step is to assemble the equipment. This will be done by placing everything on a sterile tray that will already be provided in the operating room. For the procedure, usually razors, antiseptic solution, an applicator, gauze, and basins for the solution will all be needed. So those will all be placed onto a sterile tray, so they'll be ready for whenever the surgeon and or nurse needs them. Here's a picture of some of the things. You can see gloves, antiseptic solutions, the sponges, and gauze. The next step is hair removal. Before ever touching a patient, gloves always need to be put on. So put on gloves, then a sterile razor will be used, and basically you just shave near the incision, gentle strokes opposite of hair growth. The hair really needs to be completely gone because it can affect the healing of the wound and the surgery overall. But it also has to be made sure that the patient is not harmed while doing this step. After this, the next step is to get the solution ready. So pads will be placed around the patient so that excess fluids or whatever that comes off will be soaked up by the pads, because pooling of the solution can lead to infection, which does not want to occur. So it's very simple. Just pour the solution into a basin, and usually the solution is ready to use, but sometimes it needs to be diluted with sterile water. So that's just simply pouring sterile water as well into the basin with the solution. Then, as you can see here, this is an applicator. There's a sponge at the bottom. You simply put the applicator into the solution, leave it there for about 3 seconds so it can soak up as much solution as possible. And then you start to apply the solution to the patient. This is done in actually a specific manner because you really want to make sure that you get every part of the skin to completely diminish the risk of infection. You start at the incision point and work toward the periphery of the body. As you can see in this picture, if you're starting at the chest, you start and make your way out to the outer parts of the body in a circular motion. This really decreases the chance of skin not being covered in solution and makes it so infection will not be an issue. So, like I said, the skin will be scrubbed in a circular motion. Every time that you get to a specific point, there's not enough solution, you actually have to grab a whole new applicator and start the process over again. Usually there's a specific time at hospitals that the nurse needs to scrub for. At Levita, it was 5 minutes that they had to keep doing that to make sure the skin was totally prepared for what was about to take place. After the solution is on the patient, the skin will need to be dried with a sterile towel, just simply patting the area with a sterile towel to get any excess solution or pooling that's occurring off. This is super important because it allows adhesives during the surgery to stick, and it makes it so the solution won't fully get into the wounds during the surgery. Usually the drying time is about 3 minutes, and this is a picture of a patient's skin who is completely ready for surgery with adhesives on. So I learned a lot from this internship. I was really able to see what it would be like if I was working in this field, and I was able to talk to nurses and talk to other doctors while I was doing this internship. I learned a lot about all the pressure that goes into this job. It is life or death most of the time. If you're a general surgeon or trauma surgeon or even nurse, it's a huge commitment. Dr. Davis was telling me how, sometimes it's hard to do what he does, even though he loves helping people. He misses out of a lot on his own family life, which is something I don't know if I could personally do. There's a lot of pressure. The schooling is super competitive. So I basically learned that for myself. I definitely want to do something in the medical field because I want to help people. But I think I would go more towards either doctor's office or nursing due to my own personal reasons. This was a great experience, and I am super thankful for everything I was able to learn. Thank you.